because I like to eat red meat, so I guess that's good news.
I like my red meat, so I'm going to eat my red meat.
I don't know. I've never really been concerned about not eating like red meat.
A new controversial study released says eating red meat might not pose any health risks after all. The findings published in the Annals of Internal Medicine directly conflicts with multiple studies released over the last year, not to mention the latest version of Canada's Food Guide. Authors of this study concluded the advice that eating less red meat to better your health isn't backed up by good scientific evidence.
Based on our research, we cannot say with any certainty that eating red or processed meat causes cancer, diabetes, or heart disease.
A 14-member panel from 7 countries voted on the final recommendations of the new report. Johnston says prior to, all members were vetted for conflict of interest before being allowed to participate. The report findings were derived through the grade system, a study comprised of other studies, looking at multiple sources of data from existing research.
So yes, it is other people's studies that we've reviewed and meta-analyzed, but this is the only valid way to actually go forward with recommendations. Unfortunately, many authoritative organizations that make guidelines do not even do systematic reviews of the literature.
I eat very little red meat. I try to eat organic, and I stay away from ground beef.
Right now, the World Health Organization classifies red meat, such as beef, lamb, and pork, as a probable cause of cancer, while the Canadian Cancer Society also warns about limiting red meat for health reasons. And at least 6 organizations, authors, and researchers have echoed that sentiment, putting out statements under the banner, Fighting Fake Facts. The recommendation that adults continue current red and processed meat consumption is based on a skewed reading and presentation of the scientific evidence. We have a great many studies published in peer-reviewed medical journals that have found clear and compelling associations between red meat and early death. The panel's blanket recommendation that adults should continue their red meat consumption habits is highly irresponsible. We are facing a growing epidemic of diet-related chronic diseases and climate change crisis, both of which are linked to high meat consumption. Johnston notes that their research didn't take into account animal welfare, environmental concerns, or the link between eating meat and global warming. He says their research focused on human health and consumption. A detailed version of the report can be found on the Annals of Internal Medicine's website. In Winnipeg, Mark Neufeld, City News.